I'm Usha Banerjee, the Group Director Nursing at the Apollo Hospitals Group. And it's my proud privilege to say a few words on this camera today. Nurses form the largest healthcare workforce group, and 3/4 of a hospital invariably are nursing resources. Hand wash and hand hygiene practices are ingrained into every nurse's curriculum. And I must reassure and reaffirm here that nurses form an integral part and are empirical to clinical outcomes, to reimbursement and reputation of any given hospital. At the Apollo Hospitals Group, we have a huge number of nurses who invariably become true patient advocates, and they truly drive the best clinical outcomes. Hand hygiene is an integral part of the International Patient Safety Goals, which forms an important aspect of any accreditation program or patient care program. And infection prevention and infection control has to become the work ethics and the ethos of every nurse's everyday work practice. At the Apollo Hospitals Group, nurses adopt the WHO guidelines on hand hygiene and safety precautions, and our nurses deliver very good results in the space of surgical site infection prevention, healthcare associated infections in terms of catheter related bloodstream infections, the UTI, etc. Also ventilator associated pneumonias. And Apollo Hospital as an organization where the nurse is the logo, truly nurses make the logo come alive by adopting these world's best practices and benchmarks. I wish every nurse, irrespective of the curriculum, practices hand hygiene and takes it back to their home and educates every member in the society, because when we come together to practice hand hygiene and hand wash practices, we truly contribute in the Swachh India campaign that our Prime Minister has envisioned. I also wish every nurse in the entire country of our nation to adopt the best practices from the world and make it part of their day-to-day routine so that we can save many lives.